NACDL is the association of the nation's criminal defense bar.
Hello, I'm Norman Reimer, Executive Director of NACDL. I hope you are all remaining safely distanced and well during this dreadful, dreadful time. My first thoughts are for all of you, your loved ones, colleagues, and friends, and of course, for your clients and their families, especially those clients who are in jails and prisons where the risk of infection is so much worse. At NACDL, we're trying to do everything we can to support you and the defense community during this pandemic. We're amassing resources to help you in your advocacy, and you will find a treasure trove of valuable information at www.nacdl/content/coronavirus resources. But I also understand that beyond the health consequences, the economic consequences of the shutdown are enormous, especially for lawyers, whether they are in a solo, small, medium, or larger practice setting. On 9/11, my law office was a block from the World Trade Center. Fortunately, we were all safe, but I know what it is to abruptly lose access to your office and have your practice come to a virtual standstill for weeks or months. You worry about your employees, you worry about paying the bills, you worry, period. To try to lend a hand to NACDL's members, we're pleased to provide an overview of some developments and opportunities to help you get through this. In this two-part webinar series, we look first at HR developments and options, and then we will look at opportunities that may be available to you under recently enacted federal legislation. In this first segment, we are pleased to offer a presentation by Lisa Boss, a managing consultant working with the HR team. The HR team has been with NACDL for many years, and Lisa has been working with us for the past year. She has more than 20 years experience as a human resource professional, providing first-rate service to small and mid-sized organizations. Lisa earned her Bachelor of Science in Business Administration from the University of Maryland and Master's in Employment Law from Nova Southeastern University, and she holds numerous certificates and other accreditations. Lisa will discuss provisions of the Families First Coronavirus Response Act, and will discuss various benefits for employees and options for employers as they cope with this crisis. NACDL is grateful to Lisa Boss and the HR team for sharing these insights with you. I hope you find them useful. And I thank you for your dedication to our profession, to your clients, and for your support of NACDL. Together, we will get through this.
Hi, this is Lisa Boss. I'm a senior HR consultant with the HR team. We do outsourced HR services in the greater Washington, Baltimore metropolitan area. NACDL has been a client of ours for a number of years, and I serve them on a regular basis as their dedicated human resources support. Norman's asked me to share some thoughts with you as we dig through the different rules and laws that have come out in this coronavirus pandemic. And because we as HR professionals sort through this in depth on a daily basis while you're busy running your businesses, I hope this information will be helpful to you. First thing I'll talk about is the Families First Coronavirus Response Act that was passed not quite a month ago, became effective on April 1st. There's a flyer that everyone's required to deliver to their employees that you will get as part of this presentation. But the highlights of the act are, there's two different pieces. The first one is this expanded family and medical leave, which provides 12 weeks of paid leave for any active employee that's unable to work or telework due to the closure of school or daycare for an eligible dependent that's based on this COVID-19. It's really important to note that even if you are not affected by family medical leave, or you don't have to participate in it based on the size of your business, every business with less than 500 employees has to provide this expanded family and medical leave. However, it's only for people who are unable to work, and it's really important to note that if you're able to telework, you do not qualify for this leave. If your job does not allow you to telework and you have daycare issues that mean that you can't come to work, then you're able to get 2/3 of your regular pay, up to $200 a day, for a total of 12 weeks. The first 2 weeks are unpaid. I'll touch on that in a minute. And then for the next 10 weeks, it would be up to $200 a day. Again, 2/3 of your actual pay. The business is able to recoup the funds that this costs them, including the cost of providing continued medical care, health insurance, and things, through tax credits on your employment taxes. The second piece of this is the emergency paid sick leave. This provides for every employee up to 10 days of paid sick leave for if you're unable to work or telework due to COVID-19. Again, you have to be unable to work in any fashion, and these days of sick leave have to be taken in full day increments. And there's 2 different sections to this. If the individual employee is unable to work because they have been quarantined, advised by a medical professional to self-quarantine, or they actually have symptoms or illness of COVID-19 for which they're seeking a medical diagnosis, they are able to get 10 days of paid leave at their full rate of pay, up to $511 a day. If they have to take care of a family member, or again have this daycare issue because of COVID-19, they are able to get 10 days of paid sick leave, which they could use for the first 2 weeks of this expanded family and medical leave to cover that time, at 2/3 of their regular pay, up to $200 a day. And again, you tax credits, the business is able to use these tax credits on their employment taxes in order to recoup these expenses. The important thing to notice there is that in both of those instances, you must not be able to work because of a COVID-19 reason, and that includes teleworking. So for most businesses, especially in the professional world, they are able to telework, and so the expanded family and medical leave is not applicable. And the only place that would come into concern for most businesses would be the actual sick leave. So if your employee is actually sick because of COVID-19 and unable to work, then it's a good thing for you to be able to provide them with 10 days of sick leave paid at their full rate of pay, up to $511 a day, that you are able to recoup those funds from the federal government. As we think about this expanded medical leave and the paid sick leave, the other piece that's really important is there work for your employees to do? So if there is work for them to do and they're unable to do it, then that may qualify them for that leave. But if you don't have work for them to do, you really want to be thinking about trimming your workforce, hopefully for a short period of time. The 2 things to consider there are whether you're going to furlough or lay off. It's really important that you talk with any accounting professional that knows about your business, because taking out loans or stretching your reserves to pay people their salary when there isn't work for them to do is not necessarily going to give you a viable business in the long run. And so for everybody's best benefit, it's good to think about temporarily trimming your workforce. So when you furlough, you're saying this is going to be short term. We expect there to be an end date. I have work for you when you come back. They're still eligible for unemployment. You typically don't need to pay out vacation, although you can allow them to use it because you're not ending their employment. You, although you may want to adjust your paid time off policy so that accruals cease if they're in an unpaid status for a certain number of days, whether it be 2 weeks or 30 days, so that they don't keep accruing paid time off while they're not working. You need to speak with your benefits broker. Most of the insurance companies right now have been offering the opportunity for employee to waive the requirement for an employee to be actively at work to remain on your health insurance. So you don't have to put them into a COBRA status. You're able to continue their health insurance for a period of time. Whereas with a layoff, you're not really intending them to bring them back. It really is a termination of employment, but it's termination based on the fact that you don't have enough work for them to do. You would need to proceed with COBRA, and you would need to pay out their leave. And you'd need to be sure whatever your jurisdiction requires as far as your final payment of wages. Maryland says you can pay them on the next workday, next regular payday. DC says that you must pay them if it's an involuntary termination on the next business day. In either one of those circumstances, you'll want to make sure that you take care of the regular things that you do when someone's employment ends. For a furlough, you may want to just have emails forwarded. You don't necessarily need to collect equipment from people, but you need to be really aware of your exempt or salaried employees, your employees who are exempt from the overtime laws versus those who are non-exempt, because exempt employees that perform any work in a day need to be paid their regular salary, and you cannot dock their pay if they work any time in a given week under these circumstances. Check with your local Department of Labor to see what the requirements are there. Make sure for your salaried folks that you could reduce hours if you wanted to do that. I would balance that against the unemployment benefits that include that increased $600 a week that the federal government is giving through July 31st. And you'll see that quite possibly your employees can make close to the regular amount of pay that they are used to making through their weekly unemployment benefit and the $600 a week. We've included for you some templates to use to notify someone of a furlough. The next piece of information is to talk a little bit about some of the HR portions of the CARES Act. For your flexible spendings, health spendings account, health reimbursements account, the CARES Act has restored permanently the ability for those funds to be used to purchase over-the-counter medications without a prescription, as well as menstrual care products. And this is retroactive to January 1st of this year. So if your employees, you have receipts for that you have spent on any of those types of things, you're able to turn those in to get reimbursed for those. And also for plans through 2021, the CARES Act temporarily allows high deductible health plans that have a health savings account to cover any of the telehealth or remote care expenses, even if a participant hasn't reached their deductible, only for COVID-19 reasons. So this is really an important change to make sure that people who have COVID-19 symptoms or issues and seek any kind of medical assistance are able to get that without it having to reach their deductible. So it's important that people get the medical care that they need. Then the other piece of the CARES Act for us to talk about is this change to the tax favored withdrawals from retirement plans. So they've changed for the remainder of this year that they are waiving the 10% early withdrawal penalty on retirement account distributions for any COVID-19 related purposes. So this includes if your spouse or dependent is diagnosed with COVID-19 or have experienced adverse financial consequences as a result of being quarantined, furloughed, laid off, having your work hours reduced, or these other COVID-19 reasons. It's important to note there that the employer is not required to validate this reason or need. If your employee states that that is the reason that they are want to make an early withdrawal, you don't need to validate that for them. You can just allow that they may have to deal with the IRS later on that. So this is also for IRAs, individual retirement accounts, and 401ks, and some other qualified retirement plans. The maximum amount that you can draw collectively is $100,000, and the usual mandatory 20% withholding for taxes won't apply upfront. They will take 10% for taxes unless the employee waives that. You have the ability to waive it and ask them not to withhold any taxes. And you're able to spread out any payment of taxes on these distributions for up to 3 years, over a 3-year period. You also have 3 years to pay that amount back into your account. So they also are allowing loans. The repayment, if you have a repayment that's due in 2020, you can delay your repayment for up to 1 year, and then the subsequent payments will be adjusted to account for the delay. Also, the loans are capped at $100,000 or 100% of your vested account balance, whichever is less. That for any loans taken within 180 days of this law's enactment. They also are waiving required minimum distributions for taxpayers who are 70 and a half and are required to be withdrawing funds. It's really important that you talk with your broker about these potential changes. And please note that some plans offer you the opportunity to opt in or opt out of these changes. Some plans have automatically enacted them, and others are requiring you to affirmatively reply that you want to participate in that. So that's information that's helpful to you and to your employees in the midst of this coronavirus pandemic. I hope that this information helps you make some decisions on how best to keep your business running and take care of your people. And I hope that you all will stay well and keep up washing your hands and maintaining your social distance. Thanks so much.